Your AFib is not bad luck. Say that back to yourself. Right now, most patients believe their heart rhythm is a coin flip, something that just happens to them, completely out of their control. And that belief is wrong. And it's the exact thing that keeps people scared when they don't need to be. Here's a number that should change how you think about this forever. In one major program, 4 out of every 10 patients who aggressively controlled their risk factors stayed in a normal rhythm. No rhythm drugs, no procedures, no ablation, just 5 specific doctor-backed changes. I'm Dr. Yasser Rodriguez, and in the next few minutes, I'm going to give you those exact 5 interventions, the ones with the strongest scientific evidence behind them for slowing down and in some cases even reversing atrial fibrillation. This is for you if you were just diagnosed, if you're trying to avoid a procedure, or if you just want fewer episodes and better days. You don't need all 5 at once, you need one and start with it. All right, so let's get into exactly what the research says. Number 1 is going to surprise you. Before I give you the 5, I need you to understand why this works, because this isn't about healthy habits and some vague feel-good rah-rah video. Your atrial, rather the upper chambers of your heart, are electrically sensitive tissue. When they're stretched by high blood pressure, inflamed by excess fat around the heart, or stressed by low oxygen from sleep apnea, they physically change, they remodel. The tissue scars. The electrical signals misfire way easier. That remodeled, irritated tissue is the actual substrate that generates what you know as AFib. Here's the reframe. Your AFib isn't just a rhythm problem, it's a structural problem happening at a microscopic level in your heart tissue. And every one of these 5 things I'm about to show you directly target that structural remodeling. Not the symptom, the cause. And that's why lifestyle changes here aren't a soft, feel-good secondary recommendation. In multiple studies, aggressive risk factor management has matched or even exceeded what ablation alone achieves. And I love ablations, but this is real treatment. So, number 1, lose weight and aim for at least 10%. Okay, this is the single most powerful lever if you're carrying extra weight. It applies with a BMI of 27 or higher. In a landmark 5-year study, patients who lost 10% of their body weight were 6 times more likely to stay free of AFib than those who lost less than 3%. Even more striking, 88% of patients with the more stubborn, persistent form of AFib converted back to the milder, occasional type paroxysmal. Here's the critical detail. A causal 4 to 5% weight loss has not been shown to work. This step is critical because 10% is the threshold. This takes a structured program, maybe a dietitian, a formal weight management plan, or, where appropriate, medication or surgery. Ask your doctor specifically about a referral. Number 2, cut out alcohol. Alcohol is the most commonly self-reported AFib trigger, named by about 1 in 3 patients. A randomized trial published in the New England Journal of Medicine found that regular drinkers who stopped drinking had 45% less AFib returning over 6 months and spent less than half as much time in AFib compared to those who kept drinking. Alcohol disturbs your heart's nervous signals, raises blood pressure, adds weight, and over time enlarges and scars your atrial. What doesn't it do, right? There's no clearly safe threshold. Effects have been seen at even as few as 7 drinks a week. Aim for none. If that's not realistic right now, less is genuinely measurably better. Number 3, exercise regularly, moderate, not extreme. In the active AFib randomized trial, a 6-month program of supervised home-based aerobic exercise left twice as many patients free of AFib at 1 year, a 50% reduction in recurrence, without needing medication or ablation. Target 150 to 210 minutes per week of moderate activity. Think brisk walking, cycling, swimming. Every improvement in fitness matters. Each step up in measured fitness has been roughly linked to 9% less recurrence, independent of weight loss. One caution, extreme endurance training, marathon level volume over years is linked to more AFib, not less. Check with your care team before ramping up in your intensity. And number 4, get checked and treated for sleep apnea. My favorite. Sleep apnea shows up anywhere from 21 to 74% of AFib patients, and it's often undiagnosed. It starves your heart of oxygen at night when you sleep. It spikes your blood pressure. It stretches your atria, a direct recipe for, you guessed it, AFib. People who use CPAP show roughly a 44% lower rate of AFib recurrence compared to those who don't. I want to be honest, most of this evidence is observational rather than large randomized trials. So we don't have the certainty that we would like. But sleep apnea is worth diagnosing and treating on its own merits regardless. Watch for snoring, witness pauses by your spouse, or waking up exhausted. Number 5, control blood pressure, blood sugar, and the rest. High blood pressure is one of the strongest, most treatable drivers of AFib, causing it and bringing it back. Good control, often with an ACE inhibitor or an ARB, meaningfully reduces both. Diabetes control matters too. Certain newer medications have been linked to fewer atrial arrhythmias. And stop smoking. Full stop, please. Don't try to justify it. One quick myth bust here. Ordinary coffee is fine. Studies haven't shown coffee triggers AFib, but one trial actually found fewer recurrences among coffee drinkers. It's the energy drinks and the caffeine pills that I want you to avoid. Let me handle the concerns I know you have. This sounds like a lot at once, and it is. If you try to do all 5 simultaneously, don't. Pick one, master it, then add the next one. This is a sequence, not a checklist that you complete overnight. It's impossible. But if I do all this, can I stop my blood thinner? Well, no. This is critical, so I want to be direct. Stroke prevention depends on your age and health conditions, not on how well your AFib is controlled through lifestyle. Never stop a blood thinner or a rhythm medication without first talking to your doctors. These 5 steps work alongside your treatment plan. They do not replace it. What if I already tried losing weight and it didn't help? Ask yourself honestly whether you hit that 10% threshold with real structure and follow-up, or whether it was a smaller, unsupported attempt. The data is specific. This only works at scale with a real program behind it. Here's what's possible. Picture this from a year from now. You've lost the weight, you've cut out the alcohol, you're walking regularly, your sleep apnea was diagnosed and is treated. Your blood pressure is controlled. In study after study, patients who stack these changes see their AFib episodes shrink, fewer, shorter, milder, sometimes disappearing from persistent back to the occasional discrete episodes that we call paroxysmal, without even needing a procedure sometimes. That's not hype. That's what the data on thousands of real people shows. Here's your challenge. At your next appointment, ask 2 questions. Which of these 5 would make the biggest difference for me? And can I be referred to a structured program? Then pick just one change and make it stick for the next 30 days so that it becomes habit. And if you want a complete structured plan to bring this all together, go to fightafib.com. We've built a free AFib action plan designed to help you take these exact evidence-based steps, restore your rhythm, and reclaim your life. Go there and download it. I'm Dr. Yasser Rodriguez. Stay informed, you stay empowered, and I'll see you guys in the next video.